we're continuing to watch these cases spread. And the main question, I think, is now kind of shifting away from when will it come, because now we've hit that point, but now what can be done amongst us in our own health systems here. We'll work to get our camera set back up. The question being, at what point, after we saw what played out in China in terms of building their own structures there, they had used repurposed hotels. We saw one, unfortunately, collapse over the weekend. But building out their own structures there, I know that they have more people to deal with. But you wonder at what point will our hospitals still be able to I guess, handle all these new cases?
Yeah, it's hard to imagine in the United States something happening at the kind of scale and pace that things have happened in China, building new structures so quickly, basically overnight. I just struggle to kind of see that happening in a lot of the big metropolitan city centers in the U.S. I mean, even here in New York, the question is where? Like, where are they going to build a lot of these structures that need to be put in place to handle what might become an influx of patients that people and health professionals have never experienced before?
And we have seen in some cases that they've resorted to, or local municipalities have resorted to, at least renting out local motels or local hotels. And I think I saw an anecdote in, I think it was California, it was where they took an Econo Lodge and basically bought out a bunch of blocks of rooms and then just kind of painted over the logos and had people staying there. So the capacity problem is already happening in some corners of our country. And you do have to wonder about in the cities where maybe it's not as the outbreak hasn't been as prevalent as it's already been in, say, Seattle or in San Francisco, how cities like Dallas or how cities like Nashville are preparing for if there were to be some outbreak in their own cities as well. You have to have a contingency plan.
Yeah.
So that's something that's definitely going to be worth watching.
Well, I want to bring Dr. Wen back in on this, too, to get her take. Doctor, we were just discussing some of the problems here, but what's your take on the way that we might be able to respond to growing amounts of cases with limited resources here?
There's no question that we are at a pandemic situation. And one could argue we should have taken steps earlier, but it is hard to say. It's easy to say now in retrospect that we should have done a lot more to prepare. But I think we now need to move forward and say, we should not just be reacting to what's happened. We should be anticipating and preparing for what could happen. And we will also need to prepare for school closures, business closures, and for all of us to be practicing social distancing, keeping away from large crowds, big gatherings. We should be ready for that. And I actually think we should have been ready for that weeks ago. But hindsight is 2020, and we have to move forward with what we can do now.
Yeah, and when we think about this too, I guess there's going to be differences in regional approaches to this too, state by state, local resources as well. But a short time ago, we just did hear from the state of Florida, the Florida Department of Health officially issuing an advisory that anyone who travels anywhere internationally, they're advising that they self-isolate for 14 days upon their return. So the question becomes, if that's too little, too late, or too far, what do you make of that rule?
I think we're going to see a lot of things like that coming out, and it's not a bad idea, but we have to recognize that community transmission is happening within the U.S. because of the lack of capacity in testing. We don't exactly know how many hundreds or thousands of cases we're missing that are person-to-person spread in the U.S. And so we could be trying to contain cases of people who are coming from outside the country, but we are having this rapid spread in the U.S. too. At
what point do you think our health system can actually sustain, when we look at how many cases might come here in the U.S., at what point will our health system actually start to be in danger of not being able to meet all the cases?
We can handle a moderate outbreak. Definitely we can handle a mild outbreak. But what happens when it's severe? This is why it's so important for us to try to spread out the rate of infections, because if everybody gets sick all at the same time, our hospitals do not have nearly the capacity to handle everyone. But if we're able to space it out, and also if we're able to keep the so-called worried well at home, that's really important, because we know that in outbreak situations, a lot of people get worried, and understandably. But if you are not already going to go to the hospital, don't go just because you're worried about coronavirus, because that could also overwhelm the system.
And also important to consider every individual patient in this as well, right? Because when we're looking at people who might be most at risk, those with compromised immune systems or older Americans as well, potentially problematic.
That's right. And also, we don't want the hospital system to be so overburdened that people who need other types of care, who have heart attacks and are in accidents, now cannot receive that care too. So all that needs to be taken into consideration for hospital preparedness as well.
All right, Dr. Leana Wen, thank you so much for bringing us that and breaking it down with your expertise. Appreciate you taking the time.
Thank you.
Hey investors, Zack Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.